This is Radio Health Journal. I'm Reed Pence. This week, why Christmas Day is no holiday in the emergency room.
December 25, December 26, and January 1st have more dead on arrival deaths, more emergency department deaths than on any other day of the year.
The Merry Christmas Coronary, when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
I think it really just showed people, like, you can totally be unique and have a really great time and not be judged.
We dive into Food Network's TV series Holiday Baking Championships. Then,
retail items such as frozen chew toys are things that we see a lot of movement on right now.
Christmas is just a few days away. Have you finished all of your shopping? I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
The Christmas and New Year's holidays turn life upside down for many of us, and for the most part, that's a good thing. We have a day or two off work and the kids are out of school. Maybe relatives from out of town are staying in the spare bedroom, and there's enough food in the refrigerator to feed an army, just waiting to be prepared. But when families gather over the holidays and we're out of our routines, we can also get into trouble. Then it becomes the job of your local hospital emergency department.
What pretty much happens on those kind of holidays like Christmas and New Year's is sort of sports-related injuries when people decide to maybe have that annual pickup game of basketball or football outside. It's a weekend warrior thing, so they develop sprains and strains of muscles or broken bones.
Dr. Christopher Mikos is a longtime emergency physician in Connecticut.
Another one of the common injuries is when families gather around that Christmas table and they decide to slice up the turkey or the ham. And then we get those injuries when they're using the electric carving knife or just the regular steel blade, and they get a little clumsy or a little bit careless in trying to slice up that holiday dinner. And then people sustain the lacerations and the cuts that usually require some surgical repair in the ER.
As you might expect, the pattern is a little different a week later.
Naturally, when you talk about New Year's, that's when people unfortunately do stupid things like party too much and drink too much, get themselves involved in unfortunate car accidents, or the next morning when they come in badly dehydrated and hungover and need some medication to help overcome that constant vomiting and that dehydration and get some fluids in them.
During the holidays, especially after Christmas dinner, Mikos also sees an influx of out-of-towners who should have been in to see their local doctors long ago.
You get large family get-togethers, and there's always a conversation at the dinner table. Oh, how have you been? What's new? How's your health been? And the common discussion about, oh, I've been having maybe chest pain, or I've been having a chronic cough, meaning a cough for a long period of time. And there's that family concern about, oh my gosh, it sounds serious, you should get that checked out, or remember Aunt Martha had that and look what happened to her. So that conversation prompts people to suddenly wake up and say, well, maybe I should get that checked out. But it's been going on for a long time, but all of a sudden that family support and family concern raises people's apprehension and concern and says, well, I better get this checked out right away. So that immediately prompts a trip to the emergency room.
The patient showing up may live hundreds of miles away and have a condition that could have been easily treated months ago. But Mikos credits families for giving a push to get treatment at all.
It's not the best place to go, and a lot of these people are visiting from out of town, so they're going to an unfamiliar area. We're not able to get in touch with their private physician that's been following them or have access to their medical records, maybe a cardiogram that they've had in another hospital or a private doctor's office, a complete list of their medications. But I think people put it off because of fear. It's very natural. A lot of complaints are not serious. the emergency department is not necessarily the best place to have these things checked out that have been going on for a long time. But people put them off because of fear. And then all of a sudden, they have the family confronting them. They're bringing up stories about other family members that have had more serious problems that went unchecked for a long time. And then they said, okay, to sort of appease their family, they'll come into the emergency department.
Most of those are not life or death situations, but it turns out that the ones that are also increase during the winter. When cold weather comes, deaths increase, and Maikos says snow is often to blame.
People decide to go outside and shovel when they shouldn't. Certainly that puts the tremendous stress on the heart, the physical activity, and also the cold weather really is what brings in most people for the condition of heart attacks.
However, the wintertime increase in deaths doesn't happen just in snowy New England or in the frozen tundra of the Dakotas. Studies show the same thing is repeated in Florida, Arizona, and California, in places where it doesn't snow at all.
We actually did a study with Los Angeles County looking at death rates averaged over a course of actually 12 years, and we're surprised to see that death rates were highest during the winter months in Los Angeles, specifically December, January, where the cardiac death rates, death due to heart disease, was about 33% increased over deaths during the summer and fall.
Dr. Robert Kloner is Chief Science Officer and Scientific Director of Cardiovascular Research at Huntington Medical Research Institute and Professor of Medicine at the University of Southern California's Keck School of Medicine. He says that deaths start to rise right around Thanksgiving, and doctors don't really know why. He says it's possible that small changes in temperature can make a big difference.
Now, there are changes in the climate here in Los Angeles. It is cooler during the winter, but it's not that much cooler during the winter than other times of year. But there are changes in the temperature that occur here, so it is colder during those months as well. And we thought that that might still explain the phenomena because it's known that during the cold that there are changes in physiology, so that blood vessels tend to be more clamped down during the cold. Blood clots tend to occur easier during the cold, and people might exert more energy during the cold, especially, I suppose, if you're living in a climate that has snow, but we don't have too much snow here except in the mountains.
But it's not just the general wintertime increase in deaths that has doctors scratching their heads. It's those few particular days when sudden death rates are worst, every year, almost without fail.
December 25, December 26, and January 1st have more dead on arrival deaths, more emergency department deaths than on any other day of the year.
Dr. David Phelps is Emeritus Professor of Sociology at the University of California at San Diego.
Above and beyond the normal winter increase, there are these separate spikes in deaths for Christmas and New Year, above and beyond the normal increase. So if you look at the graph of mortality for cardiac deaths and non-cardiac deaths, you'll see that there's this kind of a hill in the middle where winter occurs, but on top of that hill there are like two antennae, one for Christmas and one for New Year.
The spike in deaths during the holidays was originally dubbed the Merry Christmas Coronary, thanks to Kloner's pioneering work documenting cardiac events. But since then, Phillips has published studies in the journals Circulation and Social Science and Medicine showing that it's not only heart attacks and strokes that spike when we're opening Christmas presents or watching the Rose Bowl on TV.
Everything is up. It's amazing. Take the most common kinds of natural causes of death. They're all spiking in the dead on arrival and ED, emergency department categories. They're all spiking on Christmas and on New Year.
One factor that could explain the spike in emergency room deaths is that a trip to the hospital is simply an inconvenience at Christmas dinner, so a life that could ordinarily be saved gets help too late.
People sometimes delay seeking medical attention during the holidays. In other words, there's this concept, well, I'll wait till after the holidays are over, and that might be dangerous. In other words, if you put off seeing someone for the chest pain you're getting at a family dinner or something like that, you say, well, I'll wait till after the dinner, I'll wait till after the holidays, that delay in seeking medical help could possibly contribute to this phenomenon of increased cardiac deaths around the holidays.
Another possible explanation that has not been ruled out by the data is that the number of medical personnel goes down around the holidays because they want to take holidays too. And in addition to that, it's probable that the medical personnel who are remaining to serve patients on Christmas and New Year are more likely to be junior because the senior ones have pulled rank and said, I'm taking a vacation now.
But why would people be having more critical health problems in the first place right around the holidays? Doctors have a whole catalog of possible causes, but no explanation for everything.
Well, it can't be just winterness because this increase is above and beyond the normal increase in winter. And actually the increase is smaller in the northern states than in the southern states. You'd expect that if it was just winter, the effect would be bigger in the northern states. It's unlikely to be psychological stress induced by the holiday because nobody has demonstrated that psychological stress can produce a sharp, sudden spike in deaths from pretty near every major cause on Christmas and then a separate spike on New Year. You might possibly get a spike from this cause of death or that cause of death from psychological stress, but it's unlikely that you would get one from cancer and other causes of death also.
The flu may also be a factor. Kloner says there's evidence that people who get a flu shot have lower rates of cardiac events, but he also believes that stress remains a pretty good candidate. Some people can relax during the holidays, but many others find them anything but restful.
They can be stressful. Sometimes you're facing family members you may not have seen for a while, this sort of thing. People expect you to purchase presents, so there's a financial burden. If you're like me, I hate shopping, so going into the malls and find parking and running around the malls to me is not something that is a lot of fun.
Then we top off our stress with some of the most unhealthy eating of the year.
We know that there's a tendency to take in more salty foods often during the holidays, and salt can lead to an increase in water retention, which can be certainly bad for our heart failure patients. And we also know that excess alcohol can have some negative effects on the heart, including inducing arrhythmias, which is altered heartbeats. One is called atrial fibrillation, which sometimes occurs with excess alcohol intake. That's often called holiday heart syndrome. There's also situations where the excess alcohol can suppress the strength of the heartbeat and make the heart somewhat weaker. So, alcohol in moderation has been associated in some studies with a reduction in cardiac events, but unfortunately people aren't always moderate during the holiday season.
So what does all this mean as we approach the holidays? First, Kloner says, don't let the holidays keep you from taking your medications. Then, take a few precautions, like getting a flu shot.
I think the other is to consider moderation in consuming alcohol, fat, salt. This is especially true in patients who have known heart disease. Also, if you have known heart disease, exposure to severe cold should be either avoided or make sure that you're bundled up, because we do know that severe cold can cause vasoconstriction, making the blood vessels kind of clamp down in both the heart and other parts of the body. This can decrease the supply of oxygen to the heart. If your blood vessels outside the heart are clamped down, then the heart has to work harder to pump blood through them. That increases the oxygen demand. We also know that certain activities during the cold, especially in cold climates, such as snow shoveling, can be deleterious. Snow shoveling is a kind of isometric exercise, and in a person with known heart disease or coronary disease, it can put extra stress on the heart.
Finally, Kloner says, if there's one person in your family who every year pushes your buttons and makes your blood boil, just keep your distance and don't take the bait. Your heart and your family will thank you. I'm Reed Pence.
Holiday celebrations are often joyous occasions, but they can be challenging for the millions of people living with Alzheimer's disease and those who care for them. The hustle and bustle of the holidays can be stressful for those with Alzheimer's, and changes in the daily routine, large gatherings, and noisy environments can create extra anxiety. Monica Marino, Senior Director of Care and Support at the Alzheimer's Association, has some tips to make the holidays enjoyable.
First, plan ahead. Prepare the host for special needs, such as a quiet room for the person to rest. If you're hosting, let guests know what to expect before they arrive. Since crosstalk and multiple conversations can be challenging for people living with Alzheimer's, try engaging the person one-on-one or in smaller groups, and keep them involved in the celebrations.
Marino also suggests experimenting with new traditions. For example, if evening confusion and agitation are a problem, turn your holiday dinner into a holiday lunch or brunch. Find out more tips at alz.org.
According to the American Cancer Society, prostate cancer is one of the leading causes of cancer deaths in American men. That's why, for men with prostate cancer at risk of progressing, monitoring for signs of progression is critical.
I'm Dr. Chris Pazanka, a urologist at Associated Medical Professionals in New York who has been paid by Janssen Biotech as a spokesperson. Men with prostate cancer, whose disease progresses after treatments like surgery or radiation, may receive hormone treatment to lower testosterone called androgen deprivation therapy, or ADT. However, for certain men, prostate cancer can further progress despite this treatment. Prostate cancer that has not spread to other parts of the body and no longer responds to a medical or surgical treatment that lowers testosterone, or ADT, is called non-metastatic castration-resistant prostate cancer, or NMCRPC. Men with NMCRPC are at risk for the disease spreading to other parts of the body. Erleada, also known as apalutamide, is a prescription medicine used to treat prostate cancer that has not spread to other parts of the body and no longer responds to a medical or surgical treatment that lowers testosterone.
In a clinical study, the median time men on Erleada lived without their prostate cancer spreading was 40.5 months versus 16.2 months. Erleada is not for use in women. Use birth control during and for 3 months after treatment with Erleada because it can cause harm or death to an unborn baby. Erleada may cause serious side effects, including heart disease, falls and fractures, and possible risk of seizure. Call your doctor right away if you experience chest pains, sudden loss of consciousness, or a seizure, and go to the nearest emergency room if you get chest pain or discomfort. The most common side effects were fatigue, joint pain, rash, decreased appetite, weight loss, high blood pressure, hot flash, and diarrhea. Tell your doctor if you get a rash. These are not all the possible side effects. Tell your doctor about your medical history of heart disease, seizures, stroke, brain injury, or tumor, and all your medical conditions. If you're concerned about your prostate cancer spreading, ask your doctor about Erleada. For more information, please see our ad in Popular Mechanics. Call 1-877-546-3586 or visit www.erleada.com.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
This is not drama or exaggeration. You can put someone into a psychotic break by going in and doing a cleanup behind their back. And I have seen that happen.
Hoarding disorder and why it's not as simple as just throwing all that stuff out.
Then, incredible advances against one of the most serious cancers of all, melanoma.
I don't use the word cure, and they certainly do not work in all patients. And when they don't work, life expectancy is limited.
All that and more on Radio Health Journal.